Yay.
Okay. So we've got an enlightening presentation today from our own Nancy Cripe, who's going to be talking in just a moment. For those of you who may be new to the scene, Nancy, you got a heart from Maggie. Health Visions Midwest is a faith-based organization. However, we do not want to offend anyone, but we do want to acknowledge that we are a faith-based organization. So therefore, we do start our meetings off with a meditation. If you're not into meditations, please lower your volume for about 30 seconds, because I'm going to say this meditation. And then you are certainly welcome to join us. Again, we welcome everyone into our ranks and want you to participate. Today, I thought this was a fitting meditation about hope. We are in the month of February and it is looking dreary outside often. If you could please mute, if you have not already muted yourself, but sometimes it's looking dreary outside. Well, I should say it looks dreary now 2 days out of the week. The other 3 days, it's springtime, and now it's winter again, okay? And so I wanted to give a meditation about hope, because when it's dreary outside, sometimes that affects how we feel on the inside and how we can hope or not hope about the future. So here we go. Morning meditation today. Lord, help us to hear you saying, I am your hope, over all the other voices. You are the hope for the hopeless. So we run to you with both hands stretched out. Fill us up with hope and give us a tangible reminder today that hope is an unbreakable spiritual lifeline. You know those things in our hearts that we barely dare to hope for. Today we give them to you. We entrust them to you. We ask this of you because we know that you can do more than we could ever guess, imagine, or request in our wildest dreams. You are our hope. Amen. So I hope that inspires those of you who were able to listen to hope for more and to know that some great stuff is in store for you. Great things are in store for the people that we have been challenged to serve. And for your organizations, those organizations that you represent. Okay, so it looks like we are up to capacity, or a decent capacity today. And it looks like I'm seeing some new faces and things. So if you are here for the very first time, I would like you to unmute and introduce yourself. Don't make me call you out. Okay, come on, Chuck.
Hey, good morning, everybody. And I feel like I'm joining a really great group of people. I appreciate the invite. I'm here representing Wayne High School, where I'm an assistant principal, and I'm here regarding gathering information regarding the tobacco survey that our school will be participating in. So thank you for having me.
Oh, wonderful. Look at that, Wayne High School. I'm liking Wayne. The principal even came to our documentary last month. I forget his name now.
Yeah, it's Principal Hauser.
Yes.
We've got a great school. We got great kids here, and we are participating in the tobacco survey as well as some other high schools here in Fort Wayne Community Schools. But I just want to collect any information on the procedures for that. But I really appreciate being invited and being a part of this group.
Wonderful. Thank you, Chuck.
Thank you.
Who else is new today?
Hi, I'm here for the first time today. My name is Zdenka, and I work at the Center for Nonviolence. I've been there for, I think, like 6 or 7 years now, and have participated in a lot of different roles there. Currently, I'm working in the women's program, the women's intervention, as a facilitator in training, and doing some admin stuff. I've done work with the youth program as well. This feels like a really sweet virtual space to have landed in, and I'm glad to be here with you all and looking forward to getting to know each other better.
Awesome, Zdenka. Thank you so much. And what's the origin of your name?
I'm from Bosnia.
Ah, okay, great. We've done a lot of work with Center for Nonviolence, and so we are so grateful for your participation today.
Thank you.
I'm new, I'm Marianne, and I'm a huge fan of Health Visions Midwest. I have told everybody in the country about that documentary. So I'm the new leader of Inasmuch Ministries, and I'm looking to expand the footprint in Fort Wayne and work closer with Sharon and Felicia because I'm their biggest fans.
All right, yes, Mary Ann
and Peggy.
Yes, and Peggy and Patricia and Lupita. Mary Ann, we met Mary Ann last week, I believe, and she is more enthusiastic than I am, and then Felicia. So it was like, wow, how can that be? Okay, who else? Thanks, Mary Ann. Anybody else that's new for the first time? Okay, I don't see anybody else coming forward. Okay, I think there are a couple of people who have been here a couple times. Okay, so we are going to move ahead with the agenda. Thank you so much. So we're going to get down to our presentation. Our presentation is someone that many of you have known and have met before, Nancy Cripe. She's the director of the coalition, director and coalition coordinator for Tobacco-Free Allen County. She's presented with us before, and she is amazing, and her coalition is doing amazing things. She's going to be presenting today about the standardized tobacco assessment for retail settings, STARS, which is what Chuck was talking a little bit about. And she's also going to chat a little bit about, if you missed it, which you should not have, but just in case you missed it, there was an amendment to the regulation of smoking ordinance in Fort Wayne, and that was a great win for TFAC. And so, Nancy, I want you to take it over. Do you have slides, Nancy?
I do, yes.
Okay. Do you want to share? You didn't get my email.
Oh, sorry.
Okay, come on. You want to share your screen?
Yeah, I'm just going to start talking a little bit about the ordinance first, and then I'll share my screen to talk about the survey. And just one point of clarification, I think there may be a confusion on Chuck's part about the surveys that we're talking about, because there's the youth tobacco survey, which is school-based, and then there's this survey, which is an assessment of how tobacco is marketed in like convenience stores and the various stores that sell it. So I'm guessing what you're talking about is the school-based youth tobacco survey. Is that correct?
Yes, you are correct. It's a survey that they ask that the schools participate in. And I'm hoping that they can include vaping into that. A lot of people vaping and tobacco, but that for us is the bigger problem right now.
Absolutely.
That we're seeing. So yeah, that's the exact survey that I'm referring to, Nancy. So if you think I should be consulting another resource, please let me know.
I think that you will benefit from this also, though, because part of the reason there is such a problem with vaping is what the kids are seeing in the retail environment.
Yeah. Yeah.
You know, and also what's happening online, which I won't really be addressing today, but it's those two things, you know, what they're seeing on social media and also what they see at their neighborhood convenience stores that's in their face every time they buy candy or soda.
Yeah.
And every time they're walking to school past all the advertisements, I mean, that plays a big role. And that there's a reason why the tobacco industry markets $1 million a day on that advertising.
Yeah, and it's convenient that those vaping pens are right between the Mountain Dew and the Cheetos and the candy.
Exactly. We're going to talk about that. Yeah.
Exactly.
So there are two different surveys. The youth tobacco survey is conducted in the fall, and we are involved in conducting that locally. So I definitely know all about that survey because I've helped administer it, and we use the results from it a lot of times in the work that we do in educating the community. So yeah, it definitely addresses the vaping. That's how we know what we know about what kids are doing in terms of vaping. So, but this one is different. This is looking at retail marketing. So first to talk about the ordinance just a little bit. So this is an exciting new development for us is that we have succeeded in getting the city council, well, I'm saying the city council did this, but it was at our request initially that we brought it to them as an issue and said, is this something we can move on to get vaping added to the ordinance that says you can't smoke in public places, you can't smoke, in any workplace in Fort Wayne or in any public space where you're exposing other people. So indoors and then anything that's an enclosed environment. And that ordinance went through like a warm knife through butter. I mean, we got no resistance to speak of. So, there were 3 council members who were not in favor of it, but we had 6-3 majority in favor of it. And it passed within, I think, 5 or 6 weeks of it being, not even, maybe less than that, of it being introduced. I mean, it was very quickly. So 3 weeks, maybe. So that's been a really great, so now in Fort Wayne, it is not only, prohibited to smoke, but also to vape. And the interesting thing is that a lot of people already thought that it was included, but it actually wasn't. If you read the language of the ordinance in 2007, when it was passed, we hardly knew about vaping. I mean, it barely existed at that point. So it was not included in the ordinance. And the other thing that we added into the language is prohibition on use of marijuana, either smoked or vaped, just as a sort of thinking ahead that if Indiana ever legalizes marijuana, it'll already be in there that you can't do it in public around other people. And also heated tobacco products, which is one of the tobacco industry's latest innovations. In the United States, they introduced a product, Philip Morris did, a product called IQOS. Now it's been taken off of the market because of a patent infringement lawsuit. So probably temporarily, we'll see. I'm sure they'll come back with some reformulated version of it that doesn't, infringe on somebody's patent. But it's a new product where you take tobacco leaf, it's put in a device kind of like a vape, and it actually somehow releases nicotine from the tobacco leaf without burning the tobacco leaf. So that's how it's different from a traditional cigarette. And it doesn't use liquids, so it's different from an e-cigarette. But it's their latest, greatest product, right? Finding another way to get people addicted, finding another way to convince people that it's a safer way to use their products. And so that's included in there as well. So it's not just vaping, it's also marijuana, it's also heated tobacco products. So we're pretty excited about that. So, and we will be, people should know this, part of what needs to happen now is the signage that everyone is supposed to have on the outside of their business, though in Fort Wayne, very few people actually do. But everyone's really supposed to have signs that say no smoking allowed within 20 feet of the entrance, at the entrance to your place of business. We are going to be creating clings that will say no smoking, no vaping within 20 feet of the entrance so that people can get that signage up, and we'll be distributing those, and we'll create thousands of them so that it won't be any problem for people to have those. We're working on trying to find some distribution points for them. I mean, because we can't go to every business in Fort Wayne and hand them out, but we will have some to hand out to associates so you can get them from us pretty easily. So that's coming. So that's the ordinance. Any questions about that? I can see my voice is going to be a problem this morning, darn it. Just when I need to talk and do a presentation. I'm hoarse already. Okay, so I will. Yes.
I was just saying I don't see any questions in the chat.
Okay. So I will bring up my slides. Come on here. From current slide. So this is the survey that we'll be doing. The STAR survey is all about assessing the local what we call point of sale tobacco marketing. And it just means the marketing that is done at the point where the product is being sold. And that's convenience stores, it's discount stores, it's mass merchandisers, pharmacies, grocery stores. That's pretty much the where tobacco is sold. And some tobacco specific stores, some liquor stores, and then of course vape shops, because vaping is a tobacco product. People like to think of it as different, but it actually is a tobacco product because the nicotine is extracted from tobacco. And the tobacco industry is heavily invested in vaping, so it is not really distinct. So this survey provides for us a window into how the big tobacco companies create and sustain addiction and health inequities. And you'll see some examples there of point of sale advertising in this slide. And I'm going to show you a whole bunch more. So just these first few slides are just some examples that were done, that photographs that we took locally of point of sale advertising. So these kinds of posters that you see on the outsides of buildings or on posts, light posts, poles, windows, doors, etc. You'll see all kinds of, big posters, ads for discounts, a lot of stuff on bargain pricing. And typically speaking, the more economically deprived the neighborhood is, the more advertising you will see, and especially advertising emphasizing cheap prices. You'll see it on gas pumps, windows, doors. On the left-hand side here, these are all different types of advertisements that are on gas pumps. So even the kid sitting in the car is getting this in their face. While mom and dad are pumping the gas, what are they looking at? Advertising for tobacco and other stuff, junk food and soda and so on. You see it inside the store very often. The signs will be placed next to, as Chuck mentioned, the candy or toys or the gum. So you see here, for example, all these signs above the snacks. And then you see in the middle, the candy that's below. It's kind of a crowded image, but you'll see these Leap e-cigarettes, Leap brand e-cigarettes sitting on the counter right above the candy bars. And on the right, you see the blue e-cigarettes right above the candy and gum. And interestingly, this is the only time I've seen this, but I find this really interesting. Not only is the product itself displayed above the candy and gum, but they have a little advertising card, about discounts and stuff hanging down over the candy and gum. So you can't even get to your candy and gum without, like moving that thing aside. Pretty clever. And why does this point of sale matter? There's several reasons. It encourages youth to start using tobacco. That's a big one. It's one of the biggest ways the industry gets youth started using. It makes quitting tobacco more difficult. It's the industry's top marketing channel. It's where they put more money than anywhere else. And it is a health equity issue because their ads will target the quantity of the ads will target marginalized communities. There's also a greater density of tobacco retailers in underserved communities. And they will place products and provide price discounts on tobacco, also targeting certain communities. I mean, the placement a lot of times is targeting youth, the product placement, and then also, to some extent, also certain communities that they'll target. For example, menthol products are going to be more heavily available in communities, in Black communities, LGBTQ communities. There's certain populations they've sort of targeted with menthol. Kids actually are also part of that targeting, but heavily with African Americans. So you'll see a lot more advertisements for menthol cigarettes and a lot more discounts for menthol cigarettes and other products in communities that are more heavily African American. And yeah, we'll talk a little bit more about that later. So exposure to in-store tobacco marketing is associated with increased odds of ever smoking, increased odds of experimental smoking, increased odds of starting smoking, and higher likelihood of becoming a daily smoker. And another thing that's not on here, I need to add it, is decreased odds of being able to quit. So if you're trying to quit, you're more likely to fail if you're surrounded by tobacco advertising. I mean, it just makes sense. It's like you're battling an addiction, and every time you go pump your gas or you go buy your snack, you've got triggers in your face for the very product to which you're addicted. And there's some good research that shows that if you live within, I think it's 1,000 feet of a tobacco retailer, it decreases your odds of quitting smoking by like half. Like, you're twice as likely to fail, basically. I wanted to say just a little bit about just background context for looking at this is what are smoking rates, and especially in Allen County compared to the United States and even to the rest of the state. So in the US right now, it's about 14%, 13.7% of adults smoke. But in Allen County, well, actually, let me take Indiana first. Indiana is the little yellow circle in the middle there, 19.4%. So 19% is already considerably higher than the 14% nationwide. So Indiana's got a problem. And then Allen County is even higher than that. We're at 20%, 20.1% as the latest information that was available as of 2020. That's from a national survey that is done of adults. And then looking just a little bit at teen use. Now this is nationwide, but our use rates tend to track right along with the average nationwide. 23.6. So basically 1 in 4 high school students are using some form of tobacco, and about 1 in 5 of them, it's e-cigarettes. So the highest percentage is definitely e-cigarettes, and you can see how the rest of the products kind of compare to the e-cigarettes. The e-cigarettes are the big one. So it's pretty high. And then the thing I wanted to point out related to this, since this is the Health Equity Coalition, is to look at, those are the overall rates. When you take the general population of teens or adults, how many of them are using tobacco? When you start drilling down a little bit and looking at different population groups, you see that by race and ethnicity, for example, that, I didn't take these in order apparently, and how I did these animations, sorry about that. By education level, 36% of those with a GED smoke. Compare that to, 3.7% of those with a graduate degree. 31%, that's right, I took these in the order of the highest levels, that's right. Serious psychological disorder, 31% of them, 32% basically are smokers, compared to only 13% of those who don't have a serious psychological disorder. And if you're uninsured, basically 24% are smoking. 23 almost percent of American Indians smoke. And this is just smoking, by the way, it's not all the other tobacco use. If your household income is under 35,000, 21%. If you're gay, lesbian, or bisexual, it's about 21% also, compared to 13.5% heterosexual. And if you're living with a disability or some kind of mental or physical limitation, about 19%, so also higher than the national average. So all of those are examples of disparities in different population groups. So a little bit more about what is point of sale marketing. To come back to that, and then we'll look at, think about the impacts of this point of sale marketing on various populations, and especially those who are already disparately affected. It's marketing to the consumer at the point where the product is sold. It includes things like displays of the product, like what we call the big power wall, the tobacco power wall that's behind the counter when you go to buy your candy or your soda and you're 10 or 11 years old. And what are you staring at? This beautiful display is full of all kinds of different colors. They're arranged very nicely. Sometimes they have brightly lit signs. They have camels on them that are really cute. And it's, every time you're buying a product, and the companies know that teens will go into a convenience store on average once a week to purchase something. That's kind of their shopping point, right? They're on the way to school, they stop and get a snack, or on the way home from school, that kind of thing. And if you think about the numbers of exposures, that is, if you're going in once a week, 52 weeks a year from the age of 13 to the age of 18, that's a lot of exposure to tobacco products. And it's one of the ways that the industry goes after kids to normalize the idea of tobacco, that, it's not like they're expecting them to be able to purchase it at that point. But what they're doing is getting them interested and getting them conditioned to think of this as a normal thing. This is something adults buy. This is, abundantly available. It is a part of adult life. And so if you're a kid, a teenager who's experimenting with being an adult, as teenagers do, trying to be more adult than they are, getting your access to this thing this alluring product that seems so normal, that seems like, part of adult life, and seems a little bit risky because you're not supposed to have it, it becomes really attractive. So if you think about the difference of the impact, some countries, I think it's New Zealand has gotten way ahead of the rest of the world in fighting tobacco use, and they're doing it really effectively. One of the things they have done is actually put all tobacco products behind a blank wall. So you have to go in and ask, I want a pack of whatever, your product is. You can't see it. And it has drastically reduced youth initiation because they're just not seeing the products. So they don't look attractive. They're not, it's not something in their consciousness. Now they're probably seeing some on the internet. So it doesn't, take away that impact, but at least it takes away the impact at point of sale. Also, there's the placement of the product, like cigarillos and e-cigarettes on the counter on the left in this image. You can barely see them, and it's not really visible on there. I mean, it is, but it isn't very big. It's hard to see in front of that power wall. But you'll see there's, the counter has an advertisement for Grizzly chewing tobacco in red. And then right above it, there's a display of e-cigarettes. And then in front of those are Black and Milds and Swisher Sweets, little cigars that are flavored. And then you'll see price promotions and interior and exterior advertising. All of those are parts of that point of sale advertising or marketing. And this is really quite different from what happened, back in the day when it was ads on TV, ads on radio, ads on billboards, print ads, and so on. All of those got outlawed. So they moved to advertising at the point of sale, which is much, much less regulated. Some places they have it regulated a lot more at the local level. In Indiana, at this point, we can't do that because there was I can't remember which law it was that was passed, but there's a law passed in Indiana probably at least a decade ago where we can't make any restrictions at the local level on how tobacco is marketed. It can only be done at the state level. And that was a gift to the tobacco industry. That was purely because tobacco lobbyists got that attached to some bill. So it is something we need to do in Indiana, but we're going to have to fight to get that, removed from state law first so that local communities can say, hey, we don't want this happening here. So again, why do we look at point of sale marketing? It encourages youth to start. It makes quitting more difficult, and it disproportionately targets some communities. Looking at Allen County, what we learned from the surveys. Now, this is results from the 2018-19 surveys that we did, because since then we haven't been able to do them because of the pandemic. This will be the first year that we've done them since. So from 2018-19, we did about 205. We did 205 assessments from 205 different stores using this national standardized tobacco assessment for retail settings instrument that collects data on product availability, price and promotions, and advertising. So one of the things that it reveals is tobacco retailer density by census tract. So you can look at how many tobacco retailers are there in a given census tract per 1,000 residents. That's what the ratio here is. So the ones that you see in this bright pink color, that's 4 retailers or more per 1,000 residents. That's considered quite dense. Those are what the tobacco control community calls a tobacco swamp when it's that dense. So lots and lots and lots of retailers in those areas that are bright pink. Orange is right behind that with 3 to 3.9 retailers per 1,000. So you see New Haven and Monroeville, for example, have high density, and I'm not sure what the one that's in the upper left, I'm not sure where that is. I need to actually really study the census tracts a little bit better to understand a bit better where some of these are that are marked in the higher colors. But certainly you can see like the yellow and orange that comes down South Central, right along the South Central corridor through Fort Wayne. And then there's one that's out Southwest. I'm guessing that's right along the, it looks like it's right along the West Jefferson 24 corridor and north of that. And then the one that's out north is probably heavily influenced by being near the mall and just how many businesses there are, period, in that area. Our density, part of what the state provided to us is comparisons with Allen County and the state. So we have 398 licensed tobacco retailers in our county. That's out of the 8,000 or so that there are statewide. The density is 1.1 per 1,000 overall. It's about the same as statewide, which is 1.3, or just slightly less. But 22% of our tobacco retailers are within 1,000 feet of a school. And that's really of concern. So that again is one of the areas where policy can intervene in places where they're allowed to do that. You can go in and say, if there's already one retailer within 1,000 feet of a school, you can't have another one. Or you can even set a law that says no retailers within 1,000 feet of a school. Some communities have done that. And then we also have 61% of our tobacco retailers are within 500 feet of another one. So that's also an indicator of a lot of density of tobacco being sold, just finding lots of it clumped together. This is just a slide that shows that, most of the stores that we assessed, the lion's share were convenience stores, but there were also some liquor stores, mass merchandisers, grocery stores, tobacco shops, pharmacies, and nothing that was other. Tobacco shop would also include vape shops, by the way. And this is pretty much the same percentage we'll be looking at this year. We have a few more stores. I think it's 213 this year, as opposed to 208 or 5 or whatever it was. But they will be pretty much the same proportion. Lion's share is convenience stores. When we looked at exterior tobacco advertising, I'm not going to go into the detail of this, but you can see that, the majority of Allen County stores were in the dark blue on all of these slides. Majority of Allen County stores did have exterior tobacco advertisements, almost 70%. Most of them had advertisements for cigarettes. Most of them had advertisements for menthols. A good number of them have advertisements for e-cigarettes and smokeless tobacco. And then it starts going down a little bit from that. And you see, for example, on the far right, way fewer of them have advertisements for premium cigars. Why is that? Because who smokes premium cigars? It's adult men, typically, or it's adults. It's not little kids or teens. And the advertising, this is part of the evidence that the advertising is targeting teenagers, is because what you see advertised is what teens are interested in, not what is more of an exclusively adult product. Here's some other examples of, the ways that they use this marketing: exterior ads on fences that create almost a billboard effect. And these are all ones that were done locally, except for the lower left one was actually taken in Huntington, in a low-income neighborhood in Huntington. I just think that's such a great example of a billboard or a fence being used as a billboard for tobacco. On storefronts and windows. This one's an example of one that is just 3 blocks from several institutions that serve youth and young adults: Ivy Tech, Concordia High School, and Purdue University. They're, this marathon on North Anthony, and it is plastered with tobacco ads. This one is also plastered with tobacco ads. I mean, those windows are almost completely covered by it almost all the time. And that is the marathon that's at East State and Crescent, right near Northside High School, and also, interestingly, near Park Center. And I don't think that's an accident either, because the industry knows those are both vulnerable populations they can target. This is the Burger Dairy or the Burger convenience store that is at Tennessee and St. Joseph Boulevard, just a few blocks from Northside High School, also a low-income neighborhood. Always has lots of tobacco advertising, including always these ads that are on posts, or that one is on a dead tree stump right next to the sidewalk, where the kids walking by on their way to school or walking to the store are going to walk right past that. It's right at their eye level. That is not an accident. Here's some examples. I wanted to point this out of the number of either really cheap products and menthol products that are being advertised in, these were all on the south side of town. So predominantly African-American, or at least a lot of African-American population. So the one on the upper right is near Southside High School. That's right off of Rudisill. The one on the far left and then the one in the middle are both right across from Whitney Young. And the one on the right is on South Calhoun and Pontiac. And then these also are, I've forgotten where this one is. It's the Shell on Oxford and I forget the cross street, across from Joshua's Temple, or what was, I think it's got a different name now, but that's what the one in the left is. Oh, and again, the one on South Side and then Whitney Young. And this is just to make the point that, menthol has been targeted to African Americans and other marginalized populations by the tobacco industry for a very long time, and with some really deadly consequences. Researchers have found that stores in predominantly Black neighborhoods are up to 10 times more likely to display tobacco ads inside and outside than retailers in areas with fewer Black residents. Also, LGBT smokers are significantly more likely to smoke menthol cigarettes. Approximately 36% of LGBT smokers report smoking menthols, as compared to 29% of heterosexual straight smokers. And in this LGBTQ plus community and tobacco use survey, which was done in Indiana, 40% of current smokers reported smoking menthol cigarettes in the last 30 days. And this is, again, Indiana. So adult smokers who reported smoking menthol cigarettes by race and ethnicity. And here you see 89.7% Black African-American, as opposed to 35% of whites of smokers. This is just of the smoker population. How many of them are smoking menthols? Lower still for Hispanics. And then other groups, you get it, if you clump them all together, about 48%. But African-American is higher than any of them. And the interesting thing, so menthol has some some serious impacts because it makes it easier to initiate. That's part of the reason why youth do it. It's easier to smoke it because it makes it go down easier. It masks the harshness. It also tastes better. And the problem is because it makes it easier to inhale and inhale deeply, it makes it easier to get addicted, which makes it then harder to quit. And the research consistently shows this, that smokers of menthols have a much harder time to quitting. And so they have heavier health consequences because they are able to inhale more deeply and because they have a harder time quitting. And they have a harder time, actually getting out of the addiction and getting into recovery. So what we find is that even though in 2019, 61% of Hoosier African Americans who smoked reported attempting to quit in the last year, a large percentage of them didn't succeed. So what we see is a larger percentage of African Americans actually making quit attempts, but percentage-wise having a harder time quitting than people who don't smoke menthols. I don't know if I said that quite right, but you can see this is percentage of smokers who attempted to quit in the last 12 months by race. And you see that there's the orange line is African American, so a higher percentage of them trying to quit. But a lot of times they don't have a high success rate.
Nancy, that is a very interesting statistic that you presented there. And we've got some interesting comments in the chat. I want to make sure that we have enough time to get to those.
Okay.
So should we just start?
Yes. Yeah, go ahead.
Okay, so there is a comment in the chat that Colleen was saying that it's interesting that the groups that face adversity or more life challenges smoke at higher rates. And then Pat commented that these groups are heavily targeted by tobacco companies. I wonder, so the question kind of is, are people smoking? Are these marginalized communities smoking, or just underserved communities smoking because they face this adversity? Or is it that big tobacco is targeting them because they are these underserved communities or vulnerable communities?
It's both. I think it's both because, and part of the reason it's both is because the tobacco industry has targeted them with the message that if you smoke, you'll feel better, right? I mean, just think of Newport ads. Pleasure. Very simple, very powerful message. Plaster that, and you see it all over the place with Newport ads. Pleasure. That's like, if you're highly stressed and distressed, and you're getting gas, or you're walking into the convenience store to grab your gallon of milk or whatever, and you're seeing that all the time, it's like that's getting in your head that this is going to make me feel better, right?
Okay.
So I think we learn that it's part of the marketing that we learn that somehow these products are going to actually relieve our stress, when they don't. They actually make people more stressed and distressed, but that's certainly not the marketing message. So people buy into it, it's like, because, you sell something powerfully enough to people, you buy the message, right? So people think, oh, I'm going to feel better if I smoke this. And certainly once you get addicted, you do feel better when you smoke it because it's relieving your withdrawal symptoms. And that is the only stress that it's really relieving. It doesn't relieve any kind of stress otherwise, but people get duped by that thinking, oh yeah, I feel so much better when I smoke. Well, you feel better when you smoke because you're in withdrawal when you're not smoking, and that feels like crap. So, but if you had never picked it up, you would actually overall feel better. Okay. But people don't know that. I mean, that's part of the education we try to do with folks is it's like and if you just think of it, this is kind of, for me, it's common sense based on my experience. I have never known a heavy smoker who's addicted who is a chill person. Mm-hmm. They are not calm, peaceful, happy people. What I experience with people who are smokers is they're very easily irritable. Why? Because every few minutes or so, every 30, 40 minutes, they're being jerked around by withdrawal symptoms, and it makes them grumpy. And yeah, they feel better when they smoke. And now they're a little bit chiller for a minute until they go right back into being irritable again because they're in withdrawal. And what I have seen and observed with people as I worked with them on quitting is once they got quit and got past that initial period where they're, in pretty heavy withdrawal and adjusting, they actually become a lot calmer and more chill people once they're not in that constant hamster wheel of I feel better, I feel worse, I feel better, I feel worse, I feel better, of running, fleeing from withdrawal symptoms all the time.
Okay, so we've got just a couple more minutes. Yeah, we've got just a couple more minutes before we need to get on to our next piece.
Let me, yeah, I've got too many slides here. I wondered if I did.
We've got a comment.
I did want to point out that this one about the addictiveness of nicotine, because people often don't realize just how addictive this product is. This is from a study that looked at, you know, all the different drugs that people typically try. 92% of US adults have tried alcohol, but only 13.8% of us get addicted to us. And some of us are using it very regularly, right? We're not getting addicted. 76% of us have tried tobacco, and 24% of us get addicted. A much higher percentage of those, you know, will get addicted if we try it. And then all the other drugs are much lower percentages. But people don't realize that of just how terribly addictive nicotine is. Much more likely to get addicted to it than any of the other drugs that we try. Okay, these are just marketing to kids, all the flavors, all the things that look like candy. And most of the retailers are selling these products. Absolutely. I mean, almost all of them. And you can see some of them, you know, placed next to candy, looking like candy and placed next to candy, and very cheap, packaged like candy. Yeah, just some examples of that, placement next to candy or snacks, ice cream, things that kids like. Those power walls that kids are looking at when they're buying anything, that's tobacco marketing. Kids who see it are more likely to smoke. And we saw in Allen County that, yes, the majority of retailers do have child-targeted advertising. Vast majority have cigarillos priced at less than $1 or single cigarillos. And about a quarter of them have tobacco advertisement at a kid's eye level or near candy, gum, and soda. Price promotions are a big thing, selling things cheaper. And 67% of our retailers offer price promotions, especially in the lower income neighborhoods. You'll see lots of price promotions. Okay, those are 2 videos, but I don't have time for them. I'll just end on the 2 key points. They're great videos. I really should have played them first because they're probably better than my presentation, but that's okay. They're short couple minute ones. I can put the links actually in the chat. I'll do that because they're really worth watching, and they're only about they're about 4 or 5 minutes long, I think. And actually it's the first 2 or 3 minutes of both of them that is really good. So the tobacco industry relies heavily on point of sale marketing. It encourages youth to start. It makes quitting more difficult. It disproportionately targets some communities, and a high percentage of Allen County tobacco retailers engage in these tactics, including displaying tobacco advertisements, having price promotions, and promoting cheap flavored youth appealing products. And I think that's my last, this is just our contact information.
Yeah, so go on ahead and put those links in the chat.
I will do that.
A couple questions that we can get to, I think, before we move on. Let's see here. So Dr. Diana is on the line, and she is saying also there's an increase in alcohol consumption, and that is generally more acceptable. But the same thing occurs. The more life challenges you have, the more likely to engage in poor behaviors. Maggie is asking, can you speak to some of the targeting coming from the tobacco industry utilizing vaping as a way of quitting smoking? Is that legitimate?
No, it's not. There's never been any proof that vaping helps people quit. In fact, what we're finding more and more, I mean, it's not to say I have a personal friend who quit smoking by vaping, and she's no longer vaping. She did use it to transition. So, you know, there's anecdotally some of those cases, but it's kind of like people who use whatever, you know, random product they use. I mean, sometimes people find all kinds of random things that work for them. On a population level, the evidence does not support using vaping to quit. What tends to happen is people end up using both. They will try to quit using vaping, do it for a little bit, go back to also smoking. And very often it leads to dual use, and dual use is actually more dangerous health-wise than using either product singly. So it's actually leading them down a worse road than if they just had kept smoking, unfortunately, which is really awful. You know, it's like going worse than smoking, and you really don't want to go that direction. I mean, you know, for the person who makes it work, great, but you certainly can't rely on that working. And they're making them now, especially certain vape products are now so powerfully addicting, like the ones that came onto the market since Juul with the innovation of what they call salt nicotine. Nicotine salts has nothing to do with salt. It has to do with the molecular structure. They add acid to it because nicotine is a base or an alkaline substance. They add an acid to it, and it actually makes it more of a smooth, it's easier to take in. So people breathe it in more deeply, but they're also concentrating the nicotine higher using that. And it is making a more addictive product. So Juul, that's part of the reason why Juul is so successful at getting so many teens addicted. They made it easier to use, and they made it more concentrated and more addicting. And now almost all the other ones are following suit. I mean, Puff Bar, Hype, Mr. Fog, all these ones that are popular with kids all have high levels of nicotine, and they all are using this salt-based nicotine formula. So, you know, not a great way to quit. You're just going from one really addictive product to one that may even be more addicting.
Nancy, can people email you to request your slides?
Yes, absolutely.
Okay, awesome. Are there any more questions for Nancy?
I just wanted to say, like, this is really interesting. And also, like, I don't have a lot of awareness around this, I guess. So it's also kind of like disturbing, like how this is like set up in this way. Like, I've never like thought about it before, I guess, you know, that like these marginalized populations are being targeted in this way. And it's just like really sad, I guess, to hear that those companies are doing that to folks that are looking, like you said, like, you know, these people are already struggling and just looking for some relief. And they're being fed this like poison that's hurting them. And it's just really unfortunate. And I also just wanted to point out like something that I've heard before about like smoking, like the part of like breathing in deeply and just like having some moments to yourself to like do something, like that seems like such a component of this like addictive process as well, where it's like people are just like need some time to themselves to like step out of like their lives and just to like breathe, but they're unfortunately breathing in these like harmful chemicals and substances. So I have heard that a lot from smokers, and especially people who work in convenience stores, people who work serving, those kind of jobs, low wage jobs where, you know, service jobs, a lot of times they don't get breaks unless they're smokers. Mm-hmm. And that's part of systemic driving of addiction. It's like, we really need to address that at system level. Why are these folks not getting breaks? In fact, they ought to be giving more breaks to the non-smokers, if anything, to encourage non-smoking. So instead, what they're doing is encouraging smoking by not giving people breaks unless they smoke. I've talked to more than one person who took up smoking for that reason, because it was the only way they could get a break at their job, which is insane. I mean, like, wow. That's really messed up about that.
Is that legal, Nancy?
No, it's probably not legal, but I mean, we're talking waiters and waitresses, people who don't have much power to fight back, even if it is illegal.
Wow.
You know, there's no union. If they complain, they're probably going to get fired. It's like, so they don't complain. They don't get the break because, you know, nobody can relieve them. If you're working alone in a convenience store, who's going to take your place while you take a break?
Wow.
But Sharon, I've seen it in factories.
Really?
I've seen it where the people who smoke got more breaks than the people who didn't smoke. So people took up smoking so they could get a break and get out of this factory. I've seen it in factories.
Yeah.
I've seen it in restaurants with clients that work in the kitchen. They have been telling me like their co-workers take breaks to go to smoke every 15 minutes and really are not like working too much, while they don't have those breaks because they don't smoke. And I can tell you one of those places in specific was these people working in the kitchen of the Bob Evans. They told me that they were staying there working with the other ones because they were smoking. They were allowed to go to smoke and take even breaks of 15 till 30 minutes pretty often and not doing the job. Yeah.
Okay.
And I don't know how to address that, but somebody needs to. It's like, what is wrong with these employers that they're even allowing people to take smoke breaks? I'm like,
well, Nancy,
why do they allow that?
Nancy, that was an awesome presentation. I'm sure if you look in the chat, you will see a lot of kudos and thank yous. I think Pat Turner has answered a lot of the questions that people had regarding
thank you, Pat.
Email and things like that. So thank you so much, Nancy. Keep up the great work with Tobacco Free Allen County. And when does your coalition meet?
So we meet on the second Wednesday of the month at noon, and we welcome new members. Please come join us. Also, if anyone is interested in participating in these store audits, we can use more volunteers. We're actually meeting today. I'm sitting here thinking maybe I'll put the Zoom link in the chat as well, because we're meeting today at noon to divide up the stores and decide who's going to do which store. So if you are interested and you can make that meeting, or just contact me and let me know, whether or not you can meet that meeting, because you don't have to be at it. We can figure it out otherwise. Okay. Especially if you got young people, it's a great thing to have young teenagers, possibly preteens, but teenagers especially help you with, because they learn a ton about how they're being targeted.
So that is the survey where you go out to the different stores and kind of make note of where those advertisements are, take those pictures, fill out the form so that she can give these types of presentations, and we can be more aware of this targeted advertising that's going on in these marginalized communities. Thank you so much, Nancy.
Thank you.
So we want to move on to some networking to find out what's going on in your world, what's happening with you out there. Does anyone have any announcements they would like to make? Olivia.
Hi there. As you guys may or may not remember, I work at the American Red Cross, and we are getting into what we call Red Cross Month. And so the month of March, we're doing a lot of outreach just to share our mission and what we do. So look for those flyers around town. But that tees us up for Sound the Alarm, which is going to be April 30th. Fingers crossed. That's where we go into the community and we install smoke alarms for free, up to 3 in a house. We do that throughout the year. So if you know anyone, anytime we can be there. We just say March 30 or April 30th will be a day that we all come together into big groups and we do canvassing, and it's kind of like trying to build internal communities. So be looking for that. So again, they're free. We just want to do like a 2-minute education plan, and then we install them all free of charge.
Okay. Free smoke alarms, they install them, no hassle. Leslie, if people know, sound the alarm. That's the month of March, right?
April 30th.
What?
April 30th is the actual canvassing day, but we can do it any day someone needs something.
Okay, all right.
Hi, Sharon.
Yes.
It's Kiona. Hi, I've been listening. I'm under Ann's face.
Oh, okay.
I wanted to let you know that we are doing Zumba March 8th and March 22nd at the Impact Center from 2:30 to 3:30 with Kristen Thompson. She owns K Monique's dance studio. And then Diane Rogers has built her own studio on 1701 Capitol Avenue. And so her first yoga class will be tomorrow. Her grand opening was yesterday, and she said that it was great. And then I'm also doing Ginger Bites March 3rd, which is actually next Thursday. Weather holds up. So we just have a lot of great programs that I've implemented on the southeast side of town for cancer services. So if you guys can come, please come and join us. We had a great time with Zumba yesterday.
All right, everybody got that. Keonia Cox with Cancer Services Network. They have expanded their outreach in the southeast at the Impact Center over at New Covenant Worship Center, and they're doing some other stuff as well. Thank you for those updates. Who else?
Hey, Sharon.
Yes, Emily.
Thank you. Emily with
Almodovar. Did I get that?
You got it. You got it. Thank you. Hi, folks. Emily with Matthew 25. So COVID really impacted our patient population as far as some of the restrictions on when you can come in and things like that. Starting tomorrow, we are scaling back a whole bunch of our COVID policies. So for example, for 2 years, our patients have not been able to bring their children into the waiting room. And a lot of our patients are babysitters or their grandmothers who are watching little ones during the day. So this is huge. This will impact a lot of our referral agencies so that you guys can know that you can send your folks to us again. mask mandate is continued. So everyone has to wear a mask in the building. However, you can have your children in the waiting room with you. That's new, that we haven't done for the last 2 years. Also, the process to become a new patient was scaled back because of COVID. You had to do your new patient interview over the phone. Now we're taking walk-ins. We're having walk-in slots back on the medical schedule, which we haven't had for 2 years. Folks can come in between 8:30 and 11:30, fill out their new patient paperwork, have their new patient interview. So this is huge for clients. Like if you've got a client in the office, now you can send them to us instead of saying, well, you've got to call them at your leisure. And sometimes, as you know, that doesn't happen. Also, we have not been able to accommodate a lot of folks who are on like work release programs, because they have to know exactly when they can be off. They either have to be, at work or in their residence. And so people with ankle monitors and things like that, it is so much more helpful to them to know when they can come and fill out their forms. So 8:30 to 11:30 is when that new patient interview process is starting up. This is all tomorrow. This is huge. So please share this with other people in your agency. We serve adults who have no insurance. So no little ones, 18 and older, no insurance at all, 200% of the federal poverty line. Thanks.
Great information, Emily. Thank you for letting us know. I know that all of us will be able to use that, and we should spread the word to our clients. I know that we here will be able to use that information. Matthew 25, opening up again for walk-ins. Yes, 8:30 to 11:30. Let's get the word out. While we're here, I want to slip in that if you missed the first showing of the Food Exodus Project, the documentary, okay, you can see that again. There is another showing tomorrow. Don't worry about the forecast for snow. You can just wipe that snow, please. Wipe that snow off your boots and come on in to Come As You Are Community Church from 6:30 to 8 tomorrow evening. The Food Exodus Project documentary about food deserts and food insecurity. We have gotten some really great feedback on that, and we know that that is really something that is making people aware of this issue. We have great panelists tomorrow. We've got Sharon Tucker from the City Council, Linda Golden, local realtor and Southeast Side advocate. Who else? Help me. I shouldn't have started naming names. Felicia, somebody help me now.
We have Danita Washington.
Yes, Danita Washington. Condra Ridley won't be able to make it. And Kathy Worley. Yes, from Parkview Health. So, and we're going to honor Thomas Brownlee as an entrepreneur. He has one of the longest standing independently Black-owned grocery stores in the Southeast. So we'll be recognizing him as part of Black History Month. You don't want to miss that. Tomorrow evening, 6:30 p.m., 7910 South Anthony Boulevard. Be there or be square. Also, March, as you all know, we have an Aspire series that happens 3 times a month on Thursdays for lunchtime, 12 to 1. The March topic is fitness. Yeah, so our first speaker on March 10th is going to be Carla Jennings. You do not want to miss Carla Jennings talking about getting your mind ready for fitness. Sometimes we just try to hop in and start working out. That's not the way. Get your mind right first. You don't want to miss that. And you'll be getting some information about that if you have not already. Also, March begins our diabetes. March 1st begins our online diabetes course. No, I'm sorry, not diabetes. Eating Smart, Being Active. Got my wrong intervention.
It's all right.
Eating Smart, Being Active on nutrition. That Peggy's going to do that. It's a deep dive into nutrition. People get incentives for that. So if you have clients who need to know more about nutrition, please tell them about this. You will be getting flyers about that. If you have not already seen that, they get incentives and they get information to live healthier lives. Anybody else?
Yeah, I do, Sharon. It'll
Yes,
go right
ma'am.
along with you talking about nutrition. We have our grant applications for our Healing Kitchen cooking classes that are going to open up on March 1st. Yay! Sharon has been a big advocate of those OHK classes. Kim, everybody. Yeah, they're really great. We give grants up to $1,500 to purchase the food, and then all the participants get these beautiful cookbooks and nutrition books put together by Parkview dietitians. And there's a lot of support and teaching if people need it. So churches are eligible, not-for-profits, just groups of anybody looking to learn about nutrition and cooking. And I put the flyer in the chat. So look for the grant applications to open up on March 1st.
I've got some things in the chat. Dr. Diana is saying that everyone is invited to the upcoming Diversity Dialogue, Transgenerational Trauma, Identity, and Violence on Friday, February 25th. If you've not looked at that, she's got some information there. John Garner from Bright Points Covering Kids and Families wants us to know about Bright Point helping people with Medicaid enrollment, completely free, helping them turn in their applications and documents, also helping people in SNAP applications, which is sorely needed. Thank you so much, John, for that. There's his number and contact information. We can capture some of this and send this out since we're running kind of late on time. Nancy's got the links to her videos. Anyone else before we close this out?
Kim has something.
Yes.
Just our adult health screenings on March 26th. The National Kidney Foundation will be hosting it. It is free. They will be doing blood glucose, also blood pressure, and also a urinalysis. The urinalysis is just basic creatine. So if anyone is concerned with what else it's testing, it is only for creatine levels. And then also we have some great sponsors who will be here as well, who will be sharing information. And Sharon, some members of your team, of course, will be there to talk about mental health. And so we're very excited.
Thank you so much, Kim. Yeah, so we've got a lot going on. Thank you all for coming and joining us today. Obviously, you have a plethora of activities that you can participate in and be enlightened and learn some things and contribute and serve. So hopefully you'll stay connected with us, take advantage of some of those things as we send them out. And maybe you'll come tomorrow to the Food Exodus Project, if you haven't already seen it. And we hope to hear you soon. Thanks so much. Have a great evening. Bye.
Thank you.